Good afternoon, and thank you for joining in today. Yesterday, on July 1st, we surpassed over 1,000 cases of COVID-19 since the start of this virus, or since the virus first came to Montana and was identified in mid-March. 222 cases are from this week alone, and we have 389 active cases in our state right now. Montana still maintains the lowest number of positives, hospitalizations, and deaths per capita in the continental United States. I say this not to de-emphasize the seriousness of new cases that we've seen over these past few weeks. Rather, to underscore that we can still get a grasp on the spread of the virus in our state. And we can if we do better as Montanans. It's clear from analyzing recent new cases that Montanans have let their guard down. There have been 6 weddings with cases associated to them. In the last 2 weeks alone, these 6 weddings in 5 different counties have directly contributed at least 24 cases to our state's count. These cases have impacted at least 7 Montana counties and at least 2 other states. Based on how quickly the virus can spread, we also do expect many more cases will be linked to these weddings in the coming weeks. It doesn't appear that the wedding itself is the problem, where measures are put into place to stress social distancing and other precautions. It seems to be the pre- and post-wedding events where guidelines aren't being followed and groups are mingling without necessary measures being taken. And it also doesn't appear that out-of-state wedding guests brought the virus here. In fact, in some instances, the virus may have been exported out of state from our wedding events in Montana. We're also seeing cases directly attributed to bar settings, where crowd control and other guidelines aren't consistently being followed. For example, Gallatin and Yellowstone counties have identified and traced at least 15 recent cases to local bars. And to be clear, that's 15 cases that came from interactions in just 3 different establishments. We're seeing additional cases from work settings. Clusters of cases have been reported in a variety of work settings, including construction crews and office settings. Even the Missoula Fire Department is not immune, recently reporting 5 cases as they work with Missoula public health professionals and begin their contact tracing efforts. At this time, at least 8 counties, Bighorn, Cascade, Flathead, Yellowstone, Gallatin, Lewis and Clark, Missoula, and Ravalli counties have indicated that they're seeing some community spread. That's cases where they're unable to link to a known case. And we do anticipate other counties could be added to this list in the coming weeks. Meanwhile, the cases that are directly connected to out-of-state travel or out-of-state contacts has not changed significantly, continuing to count for about 8% of the cases since June 1st. Our biggest problem hasn't been out-of-staters visiting Montana. It's Montanans not taking all the steps that we need to be doing to limit the transmission of COVID-19. Well, these group settings, some of which that I've just mentioned and some that were talked about last week when the epidemiology report was highlighted during the press conference. These group settings that I just noted account for about 70 of our recent cases. We know that many other cases are found through contact and the testing of individuals and household associations. In other words, as an example, those 6 weddings where we have identified 24 cases so far may well contribute to a further increase in cases as we do the contact tracing. Understanding where and how people become infected is vital to our efforts to prevent transmission. After we identify a risk, we can take steps to address it and reduce it. And it doesn't take a degree in infectious disease or epidemiology to understand that when you have large group sizes, the more risk there is for everyone involved unless steps are taken to reduce that risk. The larger the group, the more likelihood someone has the virus and can pass it on. The more you're around people that you don't regularly associate with, the more likely one of those people could be COVID positive. As Montanans are mingling in larger groups without social distancing and without wearing a mask, we are seeing more and more of these outbreaks from group settings. And I want to be clear that we are going to see more cases in the next week as additional contact tracing and testing is conducted on the cases that we're already aware of. And that's not even talking about any potential new clusters. Montanans should be prepared to continue to see high daily numbers. As we head into this 4th of July weekend, I caution that we have to act now to get our hands around this virus. Let's make sure that a couple weeks from now, we're actually starting to see a decline in cases or holding of where we are. In order to do that, we need Montanans to be extremely cautious if they're around large crowds or stay away from them. Be cautious if family visitors are in town, or wear a mask when in crowds or even indoors amongst folks you're unfamiliar with if you can't socially distance. While the virus certainly poses less risk when outside, there's still a risk. Now's probably not the time for those huge, massive backyard barbecues, and any event outside should still follow guidelines. I do have concerns about where Montana is headed, but I have greater optimism that Montanans know we have to continue to look out for one another during these times. We're certainly not in a position of some other states like Florida, Texas, Arizona, and California, who've had to close some businesses back down. Our hospitalizations have remained at a steady number despite new daily highs in cases. To put it in perspective by population, when we had 56 cases on Monday, if we were in the same position as Arizona, which had 4,000 new cases, just based on population, Montana would have reported 645 new cases on Monday. We don't have to be like these other states and take steps backwards if we again raise our guard. And one of the most important ways we can raise that guard is to make wearing a mask a habit and normalized. We're learning more about this virus every day, but it becomes increasingly clear that wearing a mask is an effective and easy way to stop the spread of COVID-19. Masking up is the responsible thing to do, because another thing that we know about coronavirus is that it spreads asymptomatically, or it can spread even if someone isn't showing any symptoms of the disease. You can look and feel completely healthy and still pass COVID-19 to your fellow Montanans. That's why it's important for all Montanans over the age of 2 to mask up when indoors and in crowds. COVID-19 spreads in respiratory droplets when we cough, sneeze, talk, laugh, and just breathe. That's why these reusable cloth masks are effective. They catch those droplets before they spread to others. And your mask doesn't need to be a medical grade filter. It just has to stop those droplets from landing on a counter or more likely spreading from one human to another. There's no need to wear a mask when you're enjoying a hiking trail with your family. You should mask up when you go to the store or pick up your takeout or hand over your keys for an oil change. By doing so, you're protecting your cashier, your server, your mechanic, and their families. Employees at public-facing businesses who wear masks will help prevent the transmission of the virus. Montanans being respectful of our businesses by wearing masks will do so too. We all want Montanans and workers to feel safe and be safe at our businesses. And when we're safe and take necessary precautions, we certainly can keep Montana open. Look, viruses aren't political. They don't care about theories or speculations or projections. They're unthinking parasites only wanting to replicate and use our bodies as a host. Wear a mask. I'm heartened this week that several associations representing businesses and taverns and breweries and lodging and hospitality and the gaming industry have called on Montanans to wear masks when social distancing isn't possible. Additionally, the Montana Brewers Association and the Tavern Association have communicated directly to their members, asking that frontline staff, such as bartenders and servers, wear masks so that we can all work together to prevent these businesses from having to close down again, in addition to the efforts to both protect their staff and their customers. And I anticipate you will be seeing more from businesses actually speaking up on the importance of this in the coming days and weeks. Montanans are independent, but we do certainly care about our neighbors and our parents and our grandparents and our Main Street businesses. I remain hopeful that Montanans will take seriously the recommendations of all those who work on the front lines so that we don't get to a point of a mandate on masks. Businesses are stepping up, and Montanans can as well. I'd like to turn it over to Todd O'Hair, who's the president and CEO of the Montana Chamber of Commerce. Thanks, Todd, and the business community for your Montana spirit in calling on folks to mask up.
Thank you, Governor Bullock. Appreciate your leadership on this issue. I'm Todd O'Hair, and I'm the president and CEO of the Montana Chamber of Commerce. The Montana Chamber of Commerce is the state's largest business advocacy organization operating in the state of Montana, representing businesses large and small across the state. We take the threat of COVID-19 seriously, not only for the impacts that the disease has on our employees, but also on our customers and on the Montana economy as a whole. On Friday of last week, we woke to read the news coming out of Texas and Florida and later out of Arizona about unacceptable rates of COVID case increases in those states. And those states took immediate actions to roll back their reopening efforts, closing down bars and taverns, reducing occupancy rates in restaurants and other businesses, and limiting social gathering sizes in those businesses. And so the one thing that I think is clear is that Montana, after having gone through a rough several months economically associated with COVID, we cannot afford to go back and experience that sort of a rollback in any shape, way, or form in Montana. On Wednesday, the Montana Chamber of Commerce joined with the Montana Restaurant Association, the Montana Tavern Association, the Montana Lodging and Hospitality Association, the Montana Gaming Association, and the Hospitality and Development Association of Montana to call on our members and the business community as a whole and the public to increase their usage of face masks out in public, especially in those times when you can't adhere to the 6-foot social distancing rule. Businesses are taking a number of steps and have for months to increase the hygiene and the sanity of their businesses. This is an additional step that we believe that businesses need to take in order to protect their employees, their customers, and ultimately the Montana economy. Government grants, low-interest loans, business bailout dollars cannot compare to healthy economic activity. Businesses will not be able to survive in Montana without a healthy economic activity in the state. And healthy economic activity is founded on a healthy population, a population that feels confident and secure that they can go about their day-to-day life, visit businesses and not have to be as concerned about contracting the COVID virus. And so the best salve for the Montana economy is going to be a healthy population. And this is an important step that we think is necessary to not only protect our employees and our customers, but also the Montana economy. Thank you, Governor. We're happy to stand with you in this effort.
Thanks so much, Todd. When we mask up as a critical component to combating this virus, we can also ensure that our kids will be able to return to the classroom in the fall. I think that every Montanan can agree, especially the parents who had to go the extra mile with their kids at home this spring, that we want our students back in the classroom. And it's more important than just to the parents and the teachers and the faculty. We really do worry about the public health impacts of COVID to our schools. We should also be worried about the public health impacts of not having our kids in schools. The American Association of Pediatricians recently underscored that in advocating that all policy considerations for the coming year should start with that goal of having students physically present in school. That's part of what they wrote in putting that out. It was pretty telling. It said the importance of in-person learning is well documented, and there's already evidence of the negative impacts on children because of school closures in the spring of 2020. Lengthy time away from school and associated interruption of supportive services often results in social isolation, making it difficult for schools to identify and address important learning deficits, as well as child and adolescent physical or sexual abuse, substance use, depression, and suicidal ideation. This in turn places children and adolescents at considerable risk of morbidity and, in some cases, mortality. Next, I'd like to turn over to Lieutenant Governor Mike Cooney, who's led a working group to develop guidance on planning for the safe and the healthy reopening of our K-12 schools. Lieutenant Governor.
Thank you very much, Governor, and thank you all for joining us here today. You know, it's no secret that the last few months have presented significant challenges, and each step of the way, Montanans have demonstrated their resilience and have adapted to numerous changes in their daily lives. While I'm certain this pandemic has affected all Montanans in one way or another, our students and those responsible for educating them have faced particularly immense disruption during this emergency. I want to thank all educators who have had to make quick and significant changes to continuing providing instruction and support to students when schools were closed to slow down the spread of COVID-19 and to give us time to learn more about this virus. And while students across the state have risen to meet the challenges with grace, Governor Bullock and I know our schools are the foundation in which future leaders of Montana are made, and we know that in-person teaching serves a critical role in the lives of students and their families. For many children, school is the best place to be. In a time of endless unknowns and constant flux, schools can provide structure and familiarity. And we know that what's going on in the world can cause anxiety among students. Schools can and often serve as an effective grounding tool. And we know that many Montana families rely on schools to supply nutritious meals, counseling, childcare. And when students are not in their classroom, teachers and staff, as the governor just mentioned, do not have close contact with students who may be at risk of child abuse and neglect. Studies have repeatedly confirmed the need for socialization and connection, especially in developmental years. Schools, of course, foster socialization and connection each and every day. And COVID-19 has exacerbated already existent inequities in our system. Inequities that public schools, often referred to as the great equalizer, can combat through equal opportunity educating. While health and safety has been and will continue to be our first priority, we cannot lose sight of the importance of in-person instruction in the process of safely reopening schools. Public education has shaped who we are today, and we want to ensure Montana's children have that same experience. It's why Governor Bullock and I have made opening our public schools a top priority. With Governor Bullock's authority to close schools during this emergency, we believe it was important for our office to put out guidance reviewed by public health experts and ensure schools have the tools they need to reopen as safely as possible this fall. That's why Governor Bullock and I consulted teachers, administrators, union representatives, and public health officials to gain insight and input from those with firsthand knowledge of the struggles schools have had and expect to have throughout this crisis. That work has led to the creation of the governor's plan for reopening safe and healthy schools. I believe that reporters have received copies of this plan, and it's also available online at the website covid19.mt.gov. I'll talk briefly about the key points of the plan and encourage folks to read it thoroughly. We know that schools look different across the state, and develop this plan not to be prescriptive, but to provide effective, flexible guidelines for all schools to safely resume in-person instruction in the fall. Releasing this plan today will give schools time to consider this guidance and to develop their own health and safety plans to reopen. And because we know every district is unique, we expect school districts to consult their local public health officials to address the specific needs of each school and to take every single possible safety measure to keep students, educators, and their staff healthy. The plan for reopening school districts has been categorized in 3 different phases that align with the 3 phases Governor Bullock's plan for reopening the Big Sky. For example, if the state is in phase 2, schools should follow phase 2 of this plan. Nothing in this guidance prevents a school from taking additional precautions based on their unique needs. Each phase has high-level guidance for schools and includes specific protocols and considerations for individual plans. Some of the basic considerations for schools include accommodations for students who will engage in remote learning and accommodations for students, teachers, and staff in at-risk groups. Schools should consider occupancy limits that allow for social distancing, rules for traffic flow and congregational spaces, and sanitation procedures. Additionally, schools should have a procedure for monitoring students and staff for symptoms and history of exposure, produce guidelines on wearing masks, guidelines in relation to isolation or quarantine if needed, and expectations on educating and posting information on how to mitigate exposure and spread. Schools are asked to think through serving meals, adjusting transportation schedules, and protocols for youth activities. The plan also includes best practices that schools can use when it comes to academics, extracurricular activities, transportation, physical and structural protocols to minimize interactions and crowding, and consider the social, emotional, and behavioral health of students. While the comprehensive practices are in the plan, some of the highlights include keeping students in the same classroom and encouraging teachers to rotate when practical, identifying ways to social distance, minimizing congregation, ensuring staff have training to identify social, emotional, and behavioral issues, and assigning seats to students on a bus, and using outdoor venues for activities. Finally, the plan includes a thorough list of additional resources for schools, including the CDC, the Office of Public Instruction, and the Montana High School Association. We also recognize that there may be other factors school districts will have to evaluate based on their own needs, and the plan strongly recommends that local public health officials are consulted throughout their planning process. I want to thank the educators and public health folks who did great work to think through how schools can keep Montana kids safe and healthy this fall. I'm confident school districts will consider this guidance and develop comprehensive plans to share with their communities and begin preparation to open this fall. Thank you very much, Governor.
Thank you, Lieutenant Governor. I'll now open it up for questions. If you'd like to ask a question, you can press 5*. You'll be notified that your hand is raised. When we unmute your phone, you'll be notified that you've been called on to ask your question. First phone question.
Hi, Governor Bullock. This is Maritza Giorgio with NBC Montana, and I have two questions. My first is the President said on the call with the Vice President that no governor said they needed anything as far as medical equipment. I'm wondering if that's true.
So I was on that call. It was on Monday of this week. Parts of it were a summary, having the governors speak about, especially the governors in some of these, the more targeted or the real hot spots, Florida, Texas, and Arizona. But actually, one of the things that did come up was a discussion about masks, and even led by Republican governors who said that we need to see more leadership from the Vice President and the President, because wearing masks, like should never become a political issue. This is something where we're really working to keep one another safe. So don't recall if there was any specific requests from a medical perspective. We continue to be both in contact with members of the federal administration as well as our local healthcare professionals about what they need. There was some discussion about increasing possibilities of testing and other ways to utilize testing materials. But then a lot of the discussion was actually about masks. Your next question, Maritza. Sorry, I should have told you that not to mute her. Can you find her? Gotcha.
Thanks, Governor.
You're back.
I'm wondering. I'm back. I'm wondering. I hear a lot about how many close contacts are being monitored county by county, and it kind of gives us an idea of how many potential cases are out there. I'm wondering if anyone knows how many close contacts are being monitored in the entire state right now.
I don't, and the thing is, we can see if we can find. It ultimately comes back to how many close contacts that every individual that ends up COVID positive might have. So I don't think that there's any aggregate number of here's how many are being monitored. And one of the things with testing, and we've seen increased numbers of cases because until not that long ago, like if you had a COVID positive individual, local public health, who's doing a great job, would reach out to that positive person, identify all their close contacts, and then tell those individuals to quarantine. Now, whether they have symptoms or not, we're testing all those close contacts, which at the end of the day does increase the number of cases reported positive, because we're finding a lot of asymptomatic cases as well. But what it also does is ensures that that individual doesn't become one of those close contacts, isn't someone that ends up then spreading it further to others. So there is no overall tally of sort of the number of close contacts being monitored, and recognize that this contact tracing is going on pretty much 24/7 in some respects. That'd be a very fluid number along the way. Next question.
Hi, Governor Bullock. This is Jonathan Hettinger from Montana Free Press. I was just wondering if you had an update on the state's testing efforts. I know you said you were trying to get to 15,000 a week. I was wondering if we're getting close to that, and kind of where we're doing the testing and where we're seeing all those increases in numbers.
Thanks for the question, Jonathan. Last week we conducted a total of 11,717 tests. The week before, 11,527. The week before that, 11,229. It's up by over 50% since a month ago, the week of May 30 to June 5. So we're certainly continuing to work aggressively toward reaching that target of 60,000 a month, or 15,000 a week. More importantly, or equally importantly too, then, we're continuing to also conduct surveillance tests in nursing homes in our tribal nations. Actually, it was earlier this week, National Public Radio reported out a study from Harvard that showed that Montana is one of only 4 states from that study doing enough testing. As far as where the additional testing is occurring, that at covid19.mt.gov, there's a listing of where there's greater community or sentinel testing going on. And we'll continue to actually work through a lot of the testings come from contact tracing as well, and continue to work through our tribal nations and others to set them up yet again on a second round after we had finished all 8 of our tribal nations at the first round. I think Browning, as an example, the Blackfeet Nation's been doing a couple days of testing just over the last couple days. Much of the community testing is listed certainly at covid19.mt.gov. We're also working with dentist office and ER rooms and others to get more, and community health centers to get more sort of the sentinel testing set up. Next phone question.
Governor, this is Mike Dennison. If wearing a mask is so important, then why aren't we requiring it in some form?
Well, Mike, I think that, look, I'm pleased to actually see that Main Street businesses are now taking the lead in some respects of saying that let's mask up not only our frontline workers, but others. And look, I hope we don't have, and we're actually going to see more announcements even early next week on that very issue, whereas people take the lead, our businesses also take the lead. This becomes not just a mandate, but it becomes something more and more socially accepted. I hope we don't have to get to the point of a mandate. But if we do, we also have to make sure that everyone's on board in order for it to be successful. And I know even right now that there are some communities looking to go in that direction. We're certainly supportive of that, but I'm heartened that it's not just government calling on folks to do it, it's businesses as well. And we'll continue to look at both how Montanans are responding, and I think the best way actually, to make sure that we're all masked up is making sure that folks in all of our communities are saying that this is something that's just acceptable. Next question.
Hi, Governor. This is Gordon Cates Carney with Montana Public Radio. Question about the school plan. I saw that Office of Public Instruction released their own reopening guidance document today for schools, and a spokesperson for OPI said that the governor's staff had input on OPI's document, but that OPI didn't have input on the governor's document. And just wondering why there are these two different documents for guidance on schools reopening.
Sure, I'll turn this because the Lieutenant Governor did the yeoman's work on this, so I'll turn it over to him.
Thanks very much, Corin. First of all, the working group did look at the initial OPI guidance that were drafted. I did have a conversation with Superintendent Arnson to discuss the plans to move forward to develop guidelines from the governor's office. And we believe it's important for our office to put out guidance that has been reviewed by public health officials and ensure schools have the tools that they need to reopen as safely as possible this fall. So again, and as you heard in our presentation, we are encouraging everybody to look at the many resources that are out there as they're developing their plan, and the Office of Public Instruction's plan is obviously one that we encourage people to look at.
Is there one plan that you're directing people to follow specifically, or which one is kind of the authority here?
So, Ian, this is Bullock, Corin. Look, in both instances, well, I haven't had the chance to review OPI's plan yet. In both instances, what we're trying to do is in July, not in August, try to provide local districts, authorities and things to take a look at in opening up and reopening our schools. Neither, or at least not our plan that we proposed or what we rolled out today, is a directive saying, here's what you must do, and expecting that local school districts should take the good work and not only inform themselves, but then work with their local public health along the way. And it's another reason that, as opposed to being prescriptive, we listed any number of resources within that. And certainly I had heard from folks around the state, and given it's sort of the authorities under this office that had closed the schools, that it was critical that we actually put out something for schools to be taking a look at in opening up. Yes, ma'am.
How closely is the state working with the university system for regular testing events on campus as school starts?
So the question was, how close is the state working with the university system as they look at, and directly the question was about testing as they open up next month. Literally just yesterday, had a meeting with our state medical officer, the head of the communicable disease division, the adjutant general, myself, some of my staff, and university staff to figure out what's the best way to go about that. So we're working very closely, and I've given the assurances to higher education that the state will provide the assistance that they need. Next phone question.
Hi, this is Parenstein from the Bozeman Daily Chronicle. I was hoping you could talk a little bit about, obviously there's been a growth in new cases, and wondering if you could talk about what the threshold might be for implementing new restrictions, or what you're thinking on how you might assess whether the state needs to implement new restrictions going forward.
Well, I think we'll be closely monitoring it all along and every step of the way. So, and it's, I'd said early on, this is a rapidly changing dynamic situation. If we look at restrictions like going back to phase one, I certainly don't think that that's necessary at this time. I do have concerns about where our cases are headed, and we need Montanans to work together. right, to get our hands around this virus now so we don't have to take those steps backwards. It's important to also recognize as we look at this that, we're not like the other states that have had to roll back to former reopening phases. Our hospitalizations have remained a low and stable number. Positivity rate remains one of the lowest in the nation. I am becoming more and more comfortable with what we're doing with testing. And I have no doubt that we're going to continue to excel at contact tracing with incredible public health folks all around the state. And so those are some of the factors that we'll keep an eye on along the way and in determining decisions, but haven't seen anything at this point that says that we have to reimpose or roll back restrictions now. But one of the reasons why we also want to do this at the start of a holiday weekend, and part of what my sort of the body of what I spoke about is that by and large there's some community spread, meaning that you don't know where that case came from, but it's large gatherings of individuals, and it can be from a wedding to a work site where folks aren't taking the adequate measures to protect themselves and one another. That's caused the increase of cases. And look, I get it. I mean, there's fatigue. People are tired of having COVID-19 in our midst, but it's only by continuing to be vigilant that we're going to ensure that we're not taking steps back.
This is Matt Hoffman from the Billings Gazette. Looking back at the school plan, this touches nearly every aspect of school operations. Do you think that schools have the money and staff to implement these recommendations?
Well, I think, Matt, that's something that, as we look at it, like first schools received $41 million from the Department of Education's elementary and secondary school emergency relief fund to help with costs related to COVID-19. And we do know that there'll be unanticipated costs associated with reopening this fall, and we'll be working with schools in trying to say how to best address that as well.
Hi,
Go ahead.
This is Iris Samuels from the Associated Press. Some counties have started to implement or consider implementing new mandates locally, like a mask requirement. So I'm curious if you're concerned about confusion and difficulty in enforcing an uneven patchwork of mandates across the state.
Iris, I'm not in as much as, and have always supported local jurisdictions and tribal jurisdictions taking the steps they believe is most necessary for their respective communities and what's happening with the virus on the ground. And by and large, as we look at, when I put out a state directive, the enforcement of that directive, it lies or rests with local officials anyway. But that's one of those areas, as like Bighorn County took some additional steps where they've seen significant transmission within the Crow Nation. It's one of those, and especially when it comes to masks. I mean, the most effective way for all of us to wear masks is for, not from a mandate, but for it to be socially accepted, for businesses to say, you know what, we're doing this to keep not just to keep open, not just because we might have to roll back to a phase one, but we're doing this to keep our employees and our customers and our community safe. So I think that there will be at times some variance, as there has been all throughout this, between our tribal nations and our counties, and at those times I certainly support them doing so.
Hey, Governor, it's Matt Bowles, the AP also, coming at you.
Are you still with the AP, Matt? I thought I saw some change.
They have to drag me kicking and screaming, Governor.
Well, congratulations, too.
Thanks. But I do have two questions for you on this. I'll try to fit them both in. Just following up on your earlier comment, what did you see in March that prompted you to issue those restrictions that you're not seeing now? Or is the saying that you're not seeing anything now, is that some kind of tacit acknowledgement that those previous measures weren't really necessary? And secondly, just following up on Corin's question, because I didn't really hear an answer to it, when Elsie Arnton's reopening guidelines conflict with your reopening guidelines, who should they listen to?
So first, to the first question, Matt, what did we see in March that we didn't see now? Is that fair?
Yeah, what did you see in March that prompted you to issue shutdowns and stay at home?
I think
we're seeing much higher cases now, and we're not seeing any
sure.
other.
No, look, I think in every single one of the reporters listening in has learned more about epidemiology and public health, presumably, than they ever knew. I mean, we've all learned a lot in the last 4 months. When we were looking at in early March, as an example, it was a lot more difficult to know how the virus was spreading in our communities. When we were in early March and even April, the notion of even making sure we had enough testing supplies for those with symptoms, forget the idea of asymptomatic or testing in larger circles, wasn't, that was a daily struggle. The idea that our healthcare workers might not have the personal protective equipment and hospital capacity was actually at a different place than it is now, was significantly different. So I do have concerns about the number of cases that we have. I think that those number of cases need to be put in context of both where they're coming from and where we are in comparatively to dang near every other state in the country. And that's where, just as in March, we've learned a lot from March to July about how this virus acts and reacts. But we will also, from that perspective, continue to monitor what's happening in our healthcare communities, continue to monitor making sure that we have the supplies that we need, continue to monitor what steps that we take which might change some of the dynamics of this. I'd said earlier, just based on the contact tracing we're doing right now, because I know also that in some respects, today's numbers reflect anywhere from 4 to 14 days ago, that I do anticipate to see in this next week or so additional cases and case increases. And as we've always done, we'll work with both the state medical officials and local public health as far as what are the best steps to take. To your second question, if there's conflicting information about within the Office of Public Instruction, what they put out an hour ago or so and what we put out, look, we'll take a close look at that. And in either way, I mean, in what we put out today, we put a dozen different places for schools and school districts to look to find additional information. I don't think either of them are supposed to be prescriptive, meaning this is what you must do. It's here's what you should be considering in reopening. Next phone question.
Hi, Governor. This is Mari Hall with the Billings Gazette. This is probably a question for Todd, but I was just wondering, what else is the Montana Chamber of Commerce doing to encourage businesses around the state to follow guidelines?
This is Todd with the Montana Chamber of Commerce, and I think that's a reasonable question. Throughout this entire COVID crisis, we put up a website that has specific information for hygiene and sanitization. We've held a number of webinars that we've encouraged businesses to participate, to look at those sort of protocols that they should consider for their business, particularly when we got close to reopening and coming into phase one. We held some webinars on some of the work that a business can do to sanitize and prepare themselves for the public. As we go forward, this is going to be something that we're going to be talking about more, is the face mask, and encouraging businesses to use face masks within their business, with their employees, and to encourage it in the public realm as well. Businesses that we've heard from and have talked to, they're very anxious on information. They're interested to kind of comply with all of the necessary and the recommended protocols, but there's a real hunger for information. And I think as this face mask science and the acceptance of this has evolved and has emerged, I think this is an important piece that I think you'll see businesses adopting that haven't adopted it already. So I think this is going to be an ongoing effort as we learn how we can better react and prepare for ongoing cases of COVID in Montana.
Thank you.
Next phone question.
Hi, Governor. This is health reporter Catherine Houghton. Looking at the state's latest analysis of confirmed COVID-19 cases, Indigenous people make up a disproportionately high percentage of those cases, and that includes hospitalizations and deaths. Can you talk about why that's the case and what the state's doing to try to slow that trend down?
Sure, yeah, and it is concerning to me. I mean, knowing that Native Americans are more at risk to the virus has concerned me since the start of it, and especially as we open things back up. I mean, that's one of the reasons why I've certainly been supportive of stricter restrictions on the tribal nations that tribal governments might put in, and encouraged Montanans and visitors to follow those. That's another of the reasons why that we turned around as we looked at ramping up testing, really tried to make sure that you could have widespread community testing for every one of our tribal nations. And we know that at the end of the day that, even as I said, within large groups, that the virus is more likely to spread where there's large gathering. Now, there's much more multi-generational housing often in our tribal nations. There are often underlying health impacts or impairments with some individuals as well in our tribal communities that are at a greater level than the general population. So from that perspective, it is concerning those numbers are, and that's one of the reasons we'll continue to work with our tribal nations to try to be as protective as possible of the residents. Last phone question.
Oh, thanks. Eric Dietrich from Montana Free Press here. One more question about mask wearing and the politicalization around that. If you were to issue a mandate, would you be worried that that could make the politicalization issue worse there, create pushback, especially given that you're a current political candidate?
It has nothing to do with that. It's how do we make sure that this is, at the end of the day, socially accepted. And look, I'm heartened this week that, because it has been. I said, look, the virus isn't political. It doesn't care from that respect what our philosophies, our ideologies are. I'm heartened this week, and I think it in part came from, there was a question earlier of the governor's call with the vice president and Dr. Fauci and Dr. Birx and Health and Human Services Azar, saying that, I'm heartened that the president said, I'm all for mask wearing and would absolutely encourage it at times, or whatever he might have said. I think the greater point of this is, every time that we put in a state restriction, in part we're asking Montanans to comply with that. Nobody wants enforcement actions. What we want to do is make sure that, we're treating our neighbors, we're acting as a community. So I certainly hope we don't get to a mask mandate. I think by businesses stepping up, by other leaders stepping up and saying, we do this to protect our neighbors or our parents or our grandparents, that the social acceptance of masks is going to be in part what drives it much more than any state or federal mandate. You guys set? Thank you all for joining. Again, thanks to Todd O'Hair, the Chamber of Commerce, the other business organizations, and enjoy the weekend, but also please do, take to heart the idea of that we know how this spreads, and we don't have to be infectious disease docs to recognize that when you're gathering with people that you're not usually gathered with, or you're within places where social distancing isn't possible, that there are steps that we can all take. And it's those steps that Montanans took much more than the directives that I put out. It was Montanans following those directives that got us to the point where we are the lowest positives, hospitalizations, et cetera, in the continental U.S. And it's the steps that Montanans will take, including over this 4th of July weekend, that'll continue to make sure that local public health, our healthcare community, and all of us can keep our hands around this virus. Thanks so much.